Hi there, I'm Dr. Stephen Phelan. Welcome to this video. Today is another video in my webinar questions answered series, and this series will focus on provisional restorations. And so today I'm going to talk about cementing provisional restorations, but we're going to talk about cementing provisional restorations on teeth. Tomorrow I'll speak about cementing provisional restorations on veneer cases because they're quite a bit different the way that I do this. So we had a number of people ask us, what do you cement the provisionals with for these cases? Dr. Riley, Dr. Watson, Dr. Freitag, there's a bunch of people asking this, so I figured this is a good question to answer. And what I'll tell you is I'm using mostly two different cements for the teeth that are prepared for crowns. So a lot of the provisional cases, you'll have a number of the teeth provisionally being crowns, and then some cases are veneers. We'll talk about veneers tomorrow. But with crowns, I'm going to cement the provisional restorations. As I said yesterday, they're splinted into sections, not the full arch, but sections of the arch. And what I'm using for the most part is a product called Cling from Clinician's Choice. I like this cement just because it seems to have good retentive qualities for these longer term big cases. So it seems to have good retentive qualities, doesn't seem to have a lot of micro leakage, and is easy to use. So it's easy to use in the sense that it has a little, the dispensing unit has a little mixing tip. So you just syringe it into the provisional. Makes it quite nice and easy to use. I've used, what is it, Temp Bond? Sorry, I'm now forgetting. I used to use Temp Bond, I believe, but I haven't used it in years since we switched to the Cling. It's actually, I think, called Cling 2 now. I'll put a picture here. So here's a picture of the product that we're using exactly. And so for the most part, we use this material, especially in the cases where we have a lot of retention form or where we have planned to remove the provisional to take out bite records after we've tested the new changes in the occlusion and the vertical dimension. So a lot of the cases, you're changing the occlusion around. You want to test that before you take the final bite records for the ceramist to build the case. So the nice way about sectioning the provisionals is I could take off certain provisionals to take the bite records after I've tested the occlusion. So having a material that I can remove and then put back on and cleans up easily is a good advantage. So for the most part, we use Cling for this. If the preps are really not very retentive, or after I've taken the bite record, if I want to put the provisionals on and leave them longer, for whatever reason, scheduling, etc. Some patients are traveling, so we know it's going to be a while. So if there's an issue where I'm really concerned about retention of the provisional, I use Duralon, which is a polycarboxylate cement. It's basically a final cement, but it's a fairly weak final cement. And the nice thing about Duralon is it has really good resistance to micro leakage and very retentive as a provisional cement, obviously. So if I have a patient who's traveling around the country or traveling around the world in the provisional restorations, I'll typically use Duralon as opposed to Cling because it's just that much more retentive. We mix the Duralon a little runny so it's easier to seat splinted provisionals and so that it's easier to remove. It's a little easier to remove if we add more liquid to the powder and have it a little runny, a little less retentive ability. The other thing you could do if you have pretty retentive preps, but you still want to use Duralon for whatever reason, you could put a little Vaseline on the prep itself. That way the provisional will come off reasonably. I will share with you a video in this series how I remove the provisionals. I'll show the tool that I use. With splinted provisionals, it's not that big a problem, even with Duralon. So that's basically it. If the retentive needs are not huge and the patient isn't traveling to another part of the world, I'll generally use Cling 2. If the retentive needs are more than what Cling 2 may be able to manage, or the patient's traveling pretty far away and I do not want the provisionals off, or if, the patient's going to be traveling for a few months and we anticipate the provisionals will be in place for multiple months as opposed to weeks, I may use Duralon. And I've used Duralon for years. It's awesome as a provisional cement. It's just a little harder to get off. And the other thing is the Duralon sticks to the prep. So with the Duralon sticking to the prep, you pretty much have to freeze the patient to remove the cement. There's some cases with cling you can just get it off. If you're especially, say, taking bite records, I can take the provisionals off and clean the cement off with cling, and I typically don't have to freeze the patient if the patient's fairly calm and doesn't have a high reaction to pain with their preps. Some people, they're more sensitive than others. Their teeth are more sensitive than others. But some people prefer not to have freezing if not absolutely needed. So with cling, I can frequently take off the provisional, remove the cement, and they don't need to be frozen. But with Duralon, I can't because it sticks to the prep. It really does. It's great that way, for micro leakage and retention, but it sticks to the prep. I have to use a sonic scaler, so I use a Cavo sonic scaler to remove it. For the most part, it won't come off with just a hand scaler, or it will take forever. So these are other considerations. I wouldn't use Duralon if you're, I wouldn't do your first case using Duralon. You might get a little freaked out about trying to manage it, or at least I wouldn't do it maybe on the anterior teeth where they're longer and more retentive. Maybe just try it out first on some shorter, less retentive posterior teeth, and then get a feel for it and used to it as a provisional restoration cement. So those are tips, just little tips. Try to keep some added tips to these videos to just give you some clinical ideas from the experience that I have of doing this for the last 23, 24 years I've been doing these cases. And so I'm just trying to give you the experience that I've developed over doing these. So thank you very much for joining me on this video. If you'd like to attend one of my clinical webinars, you can go to vdoseminar.com, vdoseminar.com, and we will connect with you there. That teaches altering the vertical dimension case studies. So you'll see 3 different case studies sharing different setup to alter the vertical dimension for each case. So it's an interesting webinar. I think you'd enjoy it. Thank you very much, and we'll talk to you soon. Take care.